Hello and welcome to Community Connections. I'm your host, Sandy Dyke. I am the Administrator and VP of Operations with Arizona Care Hospice. And today we are joined by two fabulous individuals, Claire and Mlee from Aline Health here in Fountain Hills, Arizona. So welcome to you both. Welcome to our listeners. I'm excited for our podcast for today. I know it's been a long time coming, Claire. You and I have been trying to get together, so I'm glad we can make this happen today. So welcome to you both. Claire, I'm going to ask you if you could just to kind of give us a little introduction as to what Aline Health is, and then we're going to kind of get into some specific questions for you. So can you tell us a little bit about Aline Health, how long maybe Aline Health has been around and what your focus is?
Sure. Well, thank you again for having us. And Aline Health, first and foremost, as Mlee and I were just discussing, is really my heart. It's my heart and soul. And that's what I'm really bringing here to Fountain Hills. And with that being said, it's a community center of holistic integrative health services, functional experiences that can really help you on your journey of health and wellness. We start where you are and take you where you are and go along the path with you, whether it be one of our services or many in between.
Okay. And how long has Aline Health been in the community?
So we opened our doors in April of 2021. So we're fairly new to the community.
Exciting.
We were working behind the scenes for about 2 years prior to opening our doors.
Okay. And you had mentioned services. So for our listeners, what are those services? What array of services do you provide to the community?
Right. There are quite an array, and I might even forget some. So forgive me if I do. You'll have to hop on our website. So we have biofeedback. We have infrared sauna. We have massage. We have meditation. We have aromatherapy. We even have body sculpting services with a non-invasive laser lipo and muscle building technology. We have health counseling and nutrition services. We have an array of free workshops, which are just full of helpful information with, some of them are with just different practitioners here in our building who are all super knowledgeable and really passionate about what they do.
Awesome. So, and I know you have a partner in crime there next to you, Mlee. I want to get to you as well. And so, Mlee, you have a little bit more of a specialty at Aline Health, correct?
Yes.
Can you talk a little bit about that and what you do?
Well, I do oncology massage. I worked at one of the local cancer centers here in town for about 5.5 years. And I got to work a lot with cancer patients going through various stages of treatment, surgeries, recovery, diagnosis, everything in between, all the way to survivorship. And each one had a particular need, a special need that I was able to help them with. It's very specialized. You have to understand a lot of what they can have, what they cannot have, what they're going through, and understanding how to be able to treat them so they can have the best possible massage while they're still going through any treatments that they may be required to have. I'm also a certified lymph therapist. I do
manual. You have to explain that.
Certified lymph therapist. What I do, I was trained in early 2021. And what I do is I work with people that suffer with lymphedema and also lipedema. A lot of lymphedema is secondary, where a lot of it has to do with the treatments that they received from their cancer treatments. When they have breast cancer and they have a breast removed, they may have to remove a number of nodes up underneath the armpit. And when that happens, sometimes the arm may swell and to where they have to wear sleeves and things. And when they come to me, I can help reduce some of that lymphedema through the manual lymph drainage technique. And it's also very specialized. You don't want just anyone to be able to do it. They have to have some kind of training to be able to do it, so to make sure that they do it properly,
Definitely.
that there's no harm done to the client or the patient.
So when it comes to treating those with cancer, and of course us being hospice, I definitely wanted to partner with you guys for this podcast because I think it is very important for those cancer patients to be able to get that support from such a unique means. I know I think a lot of things that pop into mind. A main thing is pain. And I'm just curious if either one of you could talk about that for those listeners who may have a cancer diagnosis, or some of the things, Emily, that you had spoke of. How does that impact them from a pain standpoint? Is there any type of pain during the massage? Does it help the pain, or, can you talk a little bit about that?
When a client comes in for an oncology massage, they may be experiencing a certain amount of pain. Of course, everyone's pain level is different depending on what they've had done. But I see a lot of fatigue with patients, stress, anxiety. But when they come in for pain, the massage is relatively light.
Okay.
As far as the pressure goes, there's a pressure scale of 1 to 5. I usually try to do anything less than a 3, because they don't want deep tissue at all, because it could harm them. Going through cancer treatments, they suffer from, of course, I just mentioned lymphedema, but they also suffer from brittle bones, some of them may have to take medication for brittle bones, and if you go in there like gangbusters and do deep tissue on them, you're liable to hurt them. And they're already experiencing enough trauma with the cancer diagnosis, the treatments, and what they're feeling from the side effects of those treatments.
Sure.
And you want to make them feel good, not hurting, and it's you want to make them leave here feeling refreshed, less pain, less fatigue, and feeling better. So they'll come back to you and continue getting the same treatment from you to make their life better.
So when it comes to those type of massages that you had mentioned, is there any type of time frame, like how many times should they be coming in for something to feel the benefits of it?
They can come in as often as they want to.
Okay.
If they're in extreme pain, let's wait till some of the pain subsides, because I don't want them to come in if they're really not up to it. But I want them to be able to, if they want to come in, I can definitely take care of them and make them feel better. And, with just a nice, gentle touch, that's all it really needs, because the actual touch, the actual touch is what helps reduce that pain level, reducing the sensations of the pain, and takes that away from them so they can relax, so they can have less fatigue. Sometimes fatigue and inflammation and pain, if you have inflammation, you're going to have pain. If you have pain, you're going to have inflammation. And if you take all of that into consideration and be able to touch them in a way that lets them know that you're not afraid to touch them. You're not going to get cancer from touching them in a massage. You can't get it from them. They can't give it to you. But you can definitely see a difference in the way they walk, the way they hold themselves, the way they feel before and afterwards, by just being able to have that special touch to help them on their journey to wellness.
Right. And I love that you touched on, and I think more people have that thought, but don't share it, is, just those misconceptions. You can't catch cancer from touching somebody. What do you come across? Are there any other misconceptions that you feel need to be kind of clarified for the community?
Yeah, some people, one of the myths that is common out there is you can move my cancer through massage from one part of the body to the other. That is not the case. If someone happens to have a tumor and a massage therapist goes way too deep thinking it's a knot, but no, it's a tumor, you could you could bust that tumor open and spread the cells.
Okay.
But if you know what you're doing and you have enough training behind you to work with these patients, they're going to let you know, yes, I have a tumor right here or on my back or wherever. And so you don't work right on top of the tumor and try to work it out, because that's not going to happen. It's there and it's going to be there unless it's surgically removed. Or chemotherapy reduces it. But you go very, very lightly and you go over it and around it. And it's almost like stroking a baby in a lot of ways. But you cannot move cancer from one part of the body to the other through a very gentle massage. Some people may have drains. Some people may have a port. You have to be aware of those different things so you can make adjustments when you're doing a massage, because you don't want them to be in pain by laying on the table when they've got a port. You want to cushion that port so it doesn't get hurt underneath, or the tubes from that port become dislodged. And so they have to go back in surgically and reattach them, because that port is their gateway to getting their treatments, getting blood, getting their chemotherapy, or anything else that they may require. So, you have to be aware of what they are going through and any adjustments you have to make with that patient.
I think that is a huge misconception. And honestly, I didn't even think about that. But when you mention it, it makes sense for people to be concerned about that. It's a very valid concern. And I think you did an amazing job of explaining that. And you definitely understand from the information you're sharing, you definitely and obviously understand the disease process when it comes to cancer and how to manipulate the body to provide that relief, but yet also give that comfort and peace of mind to the client that you're serving.
Sometimes people think that they can get a massage if they have a feeding tube. Feeding tubes normally will go into their stomach area. Okay, that's on the front side of them. If a person is in such a position to happen to have a feeding tube, they want a massage. Well, what can we do as a massage therapist? We can massage their neck and shoulders. We can massage their arms. We can massage their legs. We can also do reflexology. Some people are not able to or don't want to get a massage, but they want some sort of relief. We can work their feet through reflexology and give them the same benefits of a massage. But if you have a feeding tube, you cannot lay somebody down on their stomach. It will interfere with that. You can sideline them, you can lay them on their back and work various other parts of their body without going over on top of the feeding tube or around it. You have to stay away from it. You can, again, working their feet. Okay, you can get the same benefits of working their feet with reflexology, because the reflexology, all the points on the feet reflect the different parts of the body above. And so you can get the same benefits doing reflexology if somebody can't get a massage, but they need something to relieve them. It's just another option.
Well, I love how you guys are able to individualize the treatment that you provide. Because I know some people just don't like being touched, and everybody has their own little thing, and that's okay. But it sounds like what you're saying, you can definitely work with all those little individual intricacies, which is awesome. Claire, you had mentioned earlier when we first started talking as far as the different services, and you had mentioned biofeedback. So that's a fancy term, but can you simplify that for our listeners who might not be familiar with that, and what does that entail?
I will do my best to explain it. It's using your own body's pulse response to tell me what you need. It uses the same technology as an MRI. So if you've had, many of your clients may have had an MRI. So it's something we can feel, but we don't necessarily understand the technology. Where
Okay.
an MRI reads is a diagnostic tool, so is the OnDmed that we have. So it can kind of see where we're depleted energetically wise. It uses electromagnetic frequencies and sound frequencies, finds out where we're depleted in that department, and then it turns around and puts them back into your body. I would equate it to charging you up like your cell phone. And that would probably be the easiest way. You know, that fatigue piece we talk about, you know, what is that? That's our energy. And this can help.
Awesome.
It brings your body back up to balance.
Okay. And
Yeah.
so a quick question, and either one of you can answer this, but of course, our organization, Arizona Care Hospice, we tend mostly to the aging population. When it comes to the services that you guys provide over at Aline Health, what do you find is a more utilized service in that age group? And what can you make recommendations to the community as to maybe what might help with different things as we're aging?
Yeah, I'd like to begin and then Em can follow up. You know, massage is really one of our bigger pieces that they come in, you know, especially in this strange time we're in. People want to be touched and they need that human touch. But I'd mentioned we are a community center and we offer some workshops, and one of them is called Healing Strong, which is a free workshop, and it's for people with terminal illness. It's hosted by our health coach and her husband and myself. Her husband had stage 4 cancer and worked through it. You know, he combined Eastern and Western approaches, and so now they have a wealth of information to offer to people because it's so overwhelming when you have
Oh
a
my
diagnosis.
goodness. Yes. How often is that program offered?
So that's a 12-step program. We call it To Health and Wellness, called Healing Strong. It's really for anybody who has a chronic disease, cancer, or to not have it, to not get to that state. It's held on Mondays twice a month from 10 to about 11:30.
Okay.
And you can register online, which it's just an amazing, amazing workshop, a wealth of information. You know, we offer aromatherapy, which is just so wonderful. And, you know, that can be incorporated in any of the massages, you know, or in our infrared sauna booth too. We have the essential oils being dispersed in the air.
Okay. Awesome.
We have single services or just a group of experiences. You know, just coming to Aline Health feels good. We started with the garden outside. It will always be aromatic and something blooming, attracting butterflies and bees and hummingbirds all the time, which is just, you know, very pleasant.
It allows somebody to escape the hustle and bustle, not only of the day, but just all the stuff that they can be holding within them from whatever disease process or medical condition they may be experiencing. So I think that's amazing. It's just a little bit of an escape for them.
It is.
Okay. Mlee, do you have anything to add as far as recommendations, as far as what services Aline Health provides to the aging population?
Not specifically, but, you know, as Claire said, massage is a big part of what Aline Health offers.
Sure.
We do some stretching on people. So with the massage can be catered to any population, whether young or old, because Fountain Hills is a community that has a lot of older people. This is the perfect place for them to come and get a relaxing massage. We have a therapist that offers deep tissue. We do Reiki as well. So, you know, anything we have, whatever you need. And if you don't have it, I mean, if you're looking for something that we don't have, tell us what you're looking for, and we might be able to come up with it, whether, you know, soon or eventually, and incorporate that into our list of things that we can offer.
I love that, because I do really like that, because somebody may suggest something to you and somebody else may have offered it as well or suggested it as well. And it helps you identify the needs that are coming about in the community. So you're definitely staying on top of it, as far as offering the latest and greatest to and listening and hearing what your clients are needing and asking for. So that's awesome.
Exactly.
So Claire, if you would, I know I don't want to keep everyone too long, but I definitely wanted to make sure we had this opportunity to talk with you both and really understand more of what Aline Health offers the greater community. Claire, if somebody wants to reach out to you guys, they have questions, how do they get in touch with you?
They can call or text our main phone number, which is 480-546-7463. They can reach us on our website, alinehealthaz.com. And if they stop in, we'd love to give them a tour of the facility.
Awesome.
We have free consultations, whether it be with a massage therapist, myself, our health coach, to find out where they are and what are their needs. And make a great fit.
Awesome.
Facebook
as well. Okay. And Aline is spelled a little differently than some might think. So it's ALINE. So just so for our listeners who might be looking in that up on your website as well as Facebook, I appreciate you both taking time out today and talking with us, giving a little bit more insight peek into Aline Health. And again, you're here in the Fountain Hills community. So thank you very much to you both for joining us. To our listeners, thank you for joining us. If you haven't already subscribed to our podcast, be sure to click on the subscribe button. Make sure to do that. We would love to have you join us for our future podcasts. And Claire and Mlee, thank you so much. I appreciate you both joining us today.
Thank you so much for having us.
All right. Take care.
Thank you.